Good morning, ma'am. I am your student nurse. I am Mr. Dan Marcia Best. This morning, I will be performing a abdomen. So before we start, let's check who is your patient. So this is my patient. So today, we will be performing the assessment of the abdomen. But first, we have to, of course, gather the equipment. So I have here the stethoscope. I have here the patient gown, and I have here the working gloves. And of course, we need to identify the patient and explain the procedure to the patient to inform the purpose of the procedure. So, first is, before we start, we'll be going to first discuss about the structure, the anatomy, the anatomical structure of the abdomen. So first, as we all know, that we have 4 quadrants and we have the 9 abdominal regions that will give a guide and directions and which or where are we going to palpate, to percuss or auscultate, because that will give a specific where that specific organ can be found through doing the assessment techniques. So first is we need to, of course, ask the patient to first wear the gown. Sir, can you please? Of course, you need to ask your patient once if your patient has an existing problem pertaining to his abdomen, and that's part of the collections of data, part of that assessment. Alright, so first is you need to ask your patient to lay down. Sir, can you please lay down, sir? My patient is in the supine position. So first is you need to inspect, okay, the skin, the color, the size of the abdomen. So we need to first, can you please, sir? Okay. So in this case, the patient's abdomen is in good color, is in a good shape. There's no any lumps or mass. There's no any right? So there's no any skin problems, right? So in this case, okay, the patient is in the good normal findings. Of course, we're going to check, of course, the contour. So we need to check the contour, to check, of course, the symmetry, okay? To check if which of these sides are more bigger than the other side, if there's any abnormalities or if there's any unusuality. So in this case, the patient's abdomen has no any problem. Of course, you need to check, of course, the abdominal movement, right? So can you please move, sir? Stay. So it's quite usual, right? So there's no problem, no, during the abdominal assessment, in checking the abdominal movement. So still, when having that abdominal movement, by checking that respiration, so if there's a closed abdominal and diaphragmatic movement when the patient is inhaling or exhaling, so it is quite proportional and it is normal. Now we're going to inspect the symmetry of the abdomen. So when check the symmetry, though there's no any abnormalities, it is symmetrical, right? It's in the good shape. And first we need to do is we need to auscultate for the bowel sounds. So we need to check the vascular sounds. So in this case, we're going to use the stethoscope. So when using the stethoscope, of course, you have to use the diaphragm, right? Try to check which of this area you're going to auscultate for the bowel sounds. So in this case, the patient's abdomen has a normal bowel sounds because it has a good peristalsis movement. So there's no any brute sounds or any abnormal sounds that can be heard. And of course, is going to check the abdomen as it is also soft. There's no any unusualities can be found in the patient's abdomen. First thing we need to do is to percuss the abdominal for tone. So first is we're going to use our finger, okay? Because when you say percussion, we're going to release, we're going to produce a sound by doing a percussion. So first is going to percuss the abdominal for tone, and to be followed by the liver, the spleen, and we're going to perform the blunt percussions of the liver and the spleen. Alright, so first is, we need to do is, of course, we percuss the abdomen for tone. Next is for the spleen. So in this case, excuse me sir, right? So under the ribs, 12 ribs, right? So in this line, so we're going to palpate, we're going to percuss it. Next on the liver. And now going to check for the blunt percussions of the liver and the spleen. So it's almost it's quite the same. Okay. So in this case, okay, there's no any abnormal sounds produced by doing percussions. So it has a timpani sound. So there's no any problems. So I mean to say there's no any dullness or there's no any sounds being produced by doing the percussions. Next is the light palpations of the quadrants. So you need to, by using our hands, palpate. Okay. So in this case, there's no any abnormalities. There's no any masses. There's no any lumps that can be felt during the deep palpations and light palpations of the quadrants. Right. So next is we're going to palpate the umbilicus, the aorta, the liver, the spleen, the kidney, and the urinary bladder. So let's start with the umbilicus. Okay, first we're going to palpate the umbilicus. This is also to check if there's, of course, if there's any lumps or mass. Okay, so it has a specific measurement in which you're going to use your finger. Next is the aorta. Next is the liver. It's just only a deep palpation, light to deep palpation. And the urinary bladder. Okay, you may ask also the patients when you palpate the urinary bladder if your patient can discomfort or urge to urinate. So in this case, the patient has no sign of urinating or urge to urinate, and there's not any discomfort because it's not guarding. Okay, the patient can feel comfortable when doing the palpation of the urinary bladder. And next is for the kidney. Sir, can you please stand, sit? No, just sit. Okay. So in this case, I'll be palpating the kidney by holding the upper back. This is the upper back. Okay, and this is the lower back. So we're just only using the simplest anatomical positions. So we're going to palpate. Okay. By doing the palpation, we're also going to check if there's any presence of, like what I said, any lumps or any masses. Also, if there's any pain that can be produced, if the patient can feel plump pain. So in this case, the patient is a normal findings. Sir, can you please lay down again? Okay, for our next test would be the fluid wave test. This also to check if there's a presence of ascites, if there's a presence of fluid accumulations of the abdomen, right? So in this case, we're going to, sir, excuse me. So a patient who have the ascites as the patient who have very hard bound abdomen, and that is quite tender and hard and distended. So in this case, the patient is under normal findings. And now in the ballotment test, so we're going to ballotment test by doing the palpation. This also to check if there's any masses or there's any lumps that are present in the abdomen by pushing this way. So in this case, okay, the patient has no any signs of any masses or lumps during the ballotment test. And now for the last test for the appendicitis in the cholecystitis. For the appendicitis, we're also going to check, of course, the area or the particular quadrant in which the appendix can be found, that is in the right lower quadrant, because that is the anatomical positions of the appendix. So appendix, it is a accessory organ also of the digestive system, and also it can be if there's any inflammation of the appendix, that we call the appendicitis. That's very painful. That will cause, what will be the sign? Of course, the patient can feel fever, pain, excruciating pain, kind of pain around that area. So for us to know what is the sign of appendicitis, so we have this, the rebound tenderness, the rebound tenderness, the referred rebound tenderness, and we have the serrator sign, the ROA signs, the SOA signs, and the Rubsing signs. So first is, of course, for the rebound tenderness. Okay, so of course we're going to ask, sir, can you please pakitaas, sir? Okay. So we're going to flex this one, okay? Then release. If the patient can feel pain by flexing the legs, okay, mean to say, if can feel any pain, okay, after that, so mean to say, it might be the patient has a appendicitis, or if you feel that if you try to touch, okay, this area, okay, when you try to release it, if there's any pain that can be felt, so mean to say, it might be the patient has a sign of appendicitis. Or we'll say guarding. When you say guarding, the patient won't allow the examiner to touch the right or the area on where the appendix is located. So in this case, my patient has no any signs of appendicitis. But when identifying the appendicitis, it can be also be determined by, of course, the laboratory examinations and also other tests. Of course, the SOA sign and of course the Rubsing sign. The Rubsing sign is when going to palpate this one, and when the pain is elicited here on the opposite side, that is the Rubsing sign. And now, of course, the Murphy signs for the cholecystitis. So in the right upper quadrant, if there's any painful, if there's any signs of pain during the palpation, by doing that procedure, so if there's a Murphy sign, it means it's positive or possible cholecystitis. Alright, so that's it for this morning. That's for the assessment of the abdomen. Okay, so we are only focused on the assessment, examining the abdomen of the patient. So in this case, the patient is in the normal findings. There's no any abnormalities. The abdomen is soft and not tender. Okay, it's not distended. There's no any tenderness. Okay, the patient is a normal bowel sounds. So there's a normal barogmy sounds. So there's no any dullness sounds. So that's it for this morning. So after this, you may ask the patient and advise the patient to wait for wait for the result. And if there's any abnormalities, okay, you need to advise your client or your patient to be referred in the doctor or the physicians for further management. Then after this one, you need to remove the gloves as per the hospital infection policy. And then do hand washing. Then make a documentation. And then of course, you need to have what you call this, formulate collaborative problems and make referrals for further management. So that's it. So thank you so much, sir. So that's it for this morning. Thank you for, that's it for this morning. This is my last procedure for the health assessment. Thank you so much.